When you speak with a lot of agents throughout the week, tell me some tips that you have heard from our top agents.
Well, thanks, Karen. I just had the pleasure of speaking with 25 of our absolute top producers across the country, and they've been top producers for quite some time. And it was amazing to me some of the similarities that virtually all of them said without being prompted. And the first one, as I asked them about retention, was that they unanimously said retention starts with the sale. They all said that retention is a really important thing, but really, when you first meet the client and you're interacting with the client, that it is very important to build trust or to build friendship, and they actively make themselves available and they actively try to do that. Could be sharing their cell phone number, it could be letting them know that they're available on nights and weekends, and really making that particular client know that it's okay to call and to help them be comfortable calling. And that was fascinating to me because they almost said the same thing without knowing it.
Can you share with us one message that you have for new agents?
If you're a new agent to Advocate, these are exciting times. When we started the company, things were unprecedented with the Medicare Advantage and then later the Affordable Care Act. And we thought those were unprecedented times, but now we have a new look. So with Advocate, I want you to remember, first of all, that what is best for the client is what we're here to provide. So keep the client foremost in your mind and how you can help the client. The client is facing a unique set of challenges, especially when they're new to Medicare. They work their whole life to earn these Medicare benefits. And in a moment in time, they have a time-sensitive, complicated decision that they have to make. And there are consequences for making that decision. There's consequences in terms of the quality of care that they get, the star rating of their provider, the financing of the care. If you think about the triangle of care as it relates to access to care, cost of care, and the quality, you can help them with all three components to that triangle. And so in doing so, it's really important to think about the client being first in all the decisions as you guide them into the plan. The other thing is that don't be afraid. We are here to help you. And what we see is that a very large number of our agents are afraid that they will do something wrong or not be helpful to the client. And as a result, they don't do anything. And so we can help you with the materials and the approach, and we have training at Advocate University to help you that. We also see a very large number of agents that have anxiety because of the certification process and all the rules. It's almost a litany of all the things you can't do and the consequences, but it doesn't cover all the things you can do. And so we see a lot of apprehension to do anything because agents are just afraid, and rightfully so, to do something wrong. And so we can help you with that anxiety because we know not only how to navigate the rules properly, and have been doing this for over 15 years with hundreds of thousands of happy clients in our book of business. And thirdly, I would say that things change a little bit from when you start your advocate journey until when you get certified or contracted with the various carriers. It's very regimented, but all of a sudden you're on your own, and it's really not sink or swim, and it shouldn't feel like that, but sometimes it does. And so again, all you have to do is pick up the phone. If you don't have a personalized marketing plan, pick up the phone and call us. We know how to do that. We know how to resource you with the materials, business cards, all the things you need to properly help a client navigate these decisions and to do the follow-up to make them successful. That's what we can do for you here at Advocate.